Hello, my name is Darby Casey, and today I'm going to be sharing with you some information on congenital heart defects. If you go to a busy mall, a movie theater, or a sporting event and look around, chances are at least one of the people you see has a congenital heart defect. According to the National Heart, Lung, and Blood Institute, 8 out of every 1,000 infants born each year has a congenital heart defect. My daughter is one of these infants. Congenital heart defects are the most common type of birth defect and range from simple defects with no symptoms to complex defects with life-threatening symptoms. In my speech, I will discuss the risks of congenital heart defects, symptoms and diagnosis of congenital heart defects, and how to care for and treat congenital heart defects. According to the American Heart Association, over 1.3 million Americans alive today have some form of congenital heart defect. The word congenital means present at birth. Everyone with a congenital heart defect is born with their condition. The exact cause of congenital heart defects is still unknown, although scientists are making progress in their research. Some possible causes of congenital heart defects include genetic syndromes, a single gene, or environmental exposure of the mother during pregnancy. According to MedicineNet.com, heredity might also play a role in some congenital heart defects. A parent that has a congenital heart defect may be more likely to give birth to a child with that defect. However, rarely more than one child per family is born with a congenital heart defect. Just as there are many possible causes of congenital heart defects, there are also many different types of congenital heart defects. The American Heart Association states that congenital heart defects are often diagnosed in infancy or even before birth, although some defects are harder to detect and may not be noticed until later in childhood or even adulthood. When diagnosing congenital heart defects, cardiologists will take your medical history and perform a physical exam. They may also order other tests such as an electrocardiogram, a chest x-ray, or an echocardiogram. Severe heart defects usually become evident in infants a few months after birth. Some babies have a bluish tint to their skin or very low blood pressure shortly after birth. Some defects cause breathing difficulties, feeding problems, and poor weight gain. With congenital heart defects, some part of the heart doesn't form properly before birth, which changes the normal flow of blood through the heart. Some of the most common types of congenital heart defects include septal defects, or holes in the heart, patent ductus arteriosus, in which abnormal blood flow occurs between the aorta and pulmonary artery, and narrowed valves. Congenital heart defects can also be complex. According to the University of California, San Francisco Department of Surgery, complex congenital heart defects include combinations of simple defects, problems where the blood vessels leading to and from the heart are located, and more serious problems with how the heart develops. An example of a complex congenital heart defect is my daughter's condition. She has transposition of the great arteries, ventricular septal defect, ventricular inversion, left aortic arch, and pulmonary atresia. My daughter's condition will require medications and surgery after birth, along with more surgeries as she grows. This is an illustration of a normal heart, and this is an illustration of what my daughter's heart looks like. Although congenital heart defects can be very serious issues, not all congenital heart defects require treatment. Some only need to be observed regularly. In other cases, surgery or cardiac catheterization may be required to reduce the effects or to repair the defect. Many different medical treatments are available to heart patients to help their heart perform to the best of their abilities. Congestive heart failure, heart rhythm problems, pulmonary hypertension, and interventional cardiac catheterizations are just a few conditions that can develop in children and adults with a congenital heart defect and usually require medical treatment. Before I conclude, let me summarize my main points. I hope my speech has helped you to realize how prevalent congenital heart defects are, that there are many different types of congenital heart defects, some more severe than others, and that there are many different ways to treat congenital heart defects. I never thought that I would give birth to a baby with a congenital heart defect. I am healthy and did everything I was supposed to during my pregnancy. Congenital heart defects can affect anyone, regardless of your family's medical history. I hope my speech has helped you to realize just how serious of a condition congenital heart defects can be.